Thank all of you for your reports and presentations and debate on the floor on the liquor bill. Brian, thank you. Obviously, it's nice to be on the side of the restaurants. So that amendment didn't go anywhere. There's probably going to be one more and two more. And the subcommittee chair will either accept them or not, and hopefully people can hang with the subcommittee chair. Okay, we have one withdrawal, a 950. So we need a motion for an unfavorable. It's moved and seconded. Any debate? 950 is withdrawn, receives an unfavorable. That's off the list. We're going to go to 901. This is a bill we passed. Budget and Tax had a second. They look at the financial aspects, and we got the thumbs up, but they added some amendments. So we're going to talk about the amendments first. Okay. Madam Counsel.
So as a reminder, Senate Bill 901, Public Safety Emergency Management Resilient Maryland Revolving Loan Fund, establishes the Resilient Maryland Revolving Loan Fund within the Maryland Emergency Management Agency. The fund is special non-lapsing fund with the stated purpose of providing loans for local resilience projects that address mitigation of all hazards, including natural disasters. The bill as it came in included for fiscal 2023 and each fiscal year thereafter a mandatory appropriation of $5 million. You may recall that EHE actually adopted amendments that would have increased this appropriation to $10 million. The budget and tax amendments are on page 34 of the voting packet. They did not adopt the EHE amendments. Instead, the budget and tax amendments add co-sponsors and strike the mandatory appropriation language. For informational purposes, I've also included a letter from the state treasurer in your voting packet. This should be on 39. Essentially, what B&T has worked out is that there's actually going to be a $25 million included in the capital budget for the fund this year. So the idea with the B&T amendments is they're striking the mandatory appropriation because they're taking care of that funding separately in the capital budget. And then the B&T amendments also alter the bill's effective date to June 1st to coincide with the effective date of the capital budget.
Thank you very much, Mr. Chairman. Just wanted to make a note that there is very few times when we have a considerable number of Republicans and Democrats sponsoring the same bill. I'd like to move favorably.
Motion is to adopt and concur the B&T amendments. Senator Carrozza.
After we adopt the budget committee amendments, we would be able to offer an amendment?
Is this a sponsor amendment or?
Sponsor amendment.
Yes.
Okay, so the one caveat that I'm going to put on there is that because I think we're trying to get this bill at least on a report for tonight's session, I already sent the EHE amendments to the amendment office to let them get a head start on it.
Okay.
If they can accommodate additional co-sponsors in that amendment, we'll do it that way. If they can't, we'll do a floor amendment from EHE adding additional co-sponsors.
Yeah, let's just make it easy, Senator. Why don't you just call in an amendment, sponsor amendment? And now, does it have to, after we had...
Now that I thought we can co-sponsor at that point, I realize we're on that
on because we want to get it on today, and we had to wait to approve these amendments till the committee. I mean, the floor amendment's easy. You just say, add my name to Senate Bill 901, and they'll prepare it as amended.
Right. I mean, and if other people want to be added, we can do an EHE floor amendment if other people want to be added.
Okay. Who would like to be added? Okay.
Just Carrozza.
Yes.
Okay. We can still do it as a is an amendment from the committee, and the floor leader will just present it and say one more. And that's only if amendment office can do it in the current amendment, that's fine. I don't want to hold the bill up for just that.
If they can't, should she call it in or you call it
I can still call it in.
in? Okay. Okay, committee, council will take care of it one way or the other. Okay, I saw no objection on the concurring with the B&T and accepting their amendments. No objection to the, it's going to be a floor amendment anyway, the Crow's amendment. Okay, we don't have to revote the bill. We have already voted the bill, I think. So anybody objecting or want to vote red? Seeing none. Okay. 449. The vice chair has worked on this, but it's sort of been.
Chairman, if I can,
In a second.
can I just say, I think we ought to hold this and not talk about it now.
No, I
Save the committee some time. Sorry, so colleagues, this is about making sure that public and press and everyone that has access to public records. It just passed the House unanimously, so I just think I think it would be easier to save time. We'll have the House bill to work with. Why don't we wait for that to come over, and then we can have the conversation then and not worry about crossover deadlines. Is that okay?
That is done.
Okay.
483.
Right. So Senate Bill 483, Solid Waste Management, Organics Recycling, and Waste Diversion, Food Residuals. This bill, as introduced, requires certain generators of large quantities of food residuals to separate the food residual from other solid waste and ensure that the food residuals are diverted from final disposal in a refuse disposal system as specified. The implementation timeline for this requirement is staggered based on weekly tonnages of food residuals beginning January 1st, 2023. Affected generators may apply for a waiver. The Maryland Department of the Environment must establish related guidelines and mapping systems, as well as a plan to implement the bill as specified. Finally, the bill establishes several reporting requirements and civil penalties for a violation. There is in your packet on page 18 a reprint of the House bill as amended. Senator Hedelman has provided amendments that would just conform to the House bill. I got them a little bit late to include in the voting packet, but again, it would just be identical to what's on page 18. So essentially the amendments would exclude restaurants and the aggregate of school buildings in a local school system from the bill's requirements. That's on page 20 of the voting packet. On page 21 of the voting packet, add language clarifying the bill's requirements apply when a facility has the capacity and is willing to accept all of the person's food waste. Also on page 21, provide that the bill applies when a facility is willing to enter into a contract to accept and process the person's food residuals. On page 22, clarify that the Department of the Environment may grant a waiver for undue hardship when the cost of diverting food waste from a refuse disposal system is more than 10% more expensive than the cost of disposal. And on page 23, strikes language that would have required the Department of the Environment to report in conjunction with other state agencies on state properties that are suitable for use as organics recycling facilities.
We discussed this. It had originally it was a $250,000 or so fiscal note. I spoke with the chair of Budget and Tax today, and first with the amendments, it brings it down to 192, and he gave it the go ahead if we think it's a good policy. Personally, I think it is. So it's before us now. Senator Carrozza.
So I just want to understand, is this completely voluntary? And if so, can you logistically walk through how this works? And the reason I want to know is I have a local restaurant that's doing this on their own. And I know now restaurants, I guess, are exempt. But I want to understand what this, is this setting up a program and required, not required? And if you do participate, what And what are the mandates on the department with the reporting?
Can you repeat the question?
So I'm trying to understand what this, what this actually sets up. Is it, if it's voluntary, what are they doing? And what are the mandates on the department, even if it's a voluntary program?
So with the amendments, it's not an entirely voluntary program. It says that if you meet the, the parameters of generating at least 2 tons of food residuals, that's on or after January 1st, 2023, or at least 1 ton of food residuals. I'm looking on page 21 of the voting packet. And you are located within a 30-mile radius of a recycling facility that has the capacity to accept and process all of those residuals and is willing to do so, then you have to do it. So it is mandatory if you meet both that capacity requirement and you are within the radius of one of these existing organics recycling facilities that has the capacity to take it. There's a waiver provision that says if the cost is going to be more than 10% of, sending it to a landfill, essentially, then you can get a waiver from MDE. But otherwise, it is mandatory for that category of facilities.
So.
But again, I just want to underline, we're talking about 2 tons in a week, right? I mean.
So what is that? Are we talking institutions? I mean.
Yes.
Huh?
Potentially.
If you're a wholesaler and you have food that is spoiled, if you're a processing plant or a restaurant, I mean, 2 tons in a week is a lot. Senator Hester?
I was just going to speak in favor of the bill and try to answer the senator's question about whether it was a mandate or not. I mean, I think it's saying that you have to do this, but then there's so many ways in which if it's too difficult for you, you don't have to do it. I mean, I think the issue is we need more capacity to process this food, to keep it out of the landfills, to keep, the methane from, going into the atmosphere. And so if you can't find, if you can't find one that's willing to accept your food waste, you're basically, all set. And if there is one that can accept it, then it should be easy for you to enter in a contract and just, separate the food waste instead of putting it in with the garbage.
Look, this is getting the foot in the door. This is the beginning of a program. It's being done on small scale in at least 2 counties I know, Montgomery and Prince George's, or select neighborhoods where individuals will put almost a paint can size plastic can with their food in. It's being collected. And I think I remember from the testimony, and someone can correct me if I'm wrong, that sending this to organic recycling is cheaper than the tipping fees of taking it to a waste, a landfill. So I think the idea is to show this is positive, get the big players in first, and then slowly, if it works and is effective, and can reduce landfills, which people hate. If this can be collected and turned into fertilizer, whatever they're going to do, and remarket it, it's a win-win situation. So I think that's sort of the context for this. Well, let's have it. I don't think it's before us yet. Is there a motion to put it before us? Moved and seconded. Further discussion on the bill. Senator Riley?
As I look at a map showing organic compound recycling stuff, there's one near the Ocean City state boundary. There's another one just on the other side of the Potomac. Does this require 30 miles within Maryland or 30 miles anywhere?
Yeah, it's not limited. It doesn't say within Maryland, so.
Okay, thank you.
Further discussion on, yes, sir.
So I have a kind of interesting take or twist on this. So several years ago, when the Bel Air Wegmans market opened, I was approached by the produce manager there. To make a long story short, for a bunch of years now, myself or my employee on the farm have been going to the Wegmans and getting a truck full of produce, bread, and other items, and we feed it to the cows twice a week. I just want to make sure that this doesn't say that it has to go to, for compost or whatever. If it's being used, like in my circumstance, it's not going to the dump. It's saving the market a lot of money because they're paying for trash by the removal by the ton, I believe. And I can tell you that we're getting probably 4 to 5 tons a week out of that Wegmans going twice a week. It's going into my cows. So I don't know if it would need to be an amendment or what, but I just want to make sure this doesn't exclude. And actually, we're within that 30 miles of a area, if veteran compost is considered one of those areas. So I just want to make sure that we don't exclude what I feel is something worthwhile, like what I am doing twice a week.
Just a question, and I'll turn it to Ms. Morton and then to Senator Hester. Do they charge you for it?
No, so the agreement was I could not resell any of the food, but no, they do not charge. But see, they're making out better because they're not paying by per ton
Tipping
cost.
fee, yeah.
And honestly, they're these big industrial-sized trash cans, between 6 and 10 of them twice a week. So probably, that's a lot of stuff going into. It's free feed for my cows, so it works for me.
No,
it helps them because it's cutting down their trash costs.
No.
It's a win-win. I just don't want to see something really good and worthwhile like that inadvertently be cut out because of this.
Fair point. Ms. Morton.
So short answer is no, it doesn't. So what this says is if you, what?
Just seeking clarification. You said no, it doesn't. Doesn't include or exclude? Doesn't preclude or?
It does not preclude that.
Okay, so
So-
it'll still be allowed.
So it would still be allowed. So what this says, so that first piece about being within 30-mile radius, that's how you know whether or not you're subject to the requirements in the bill. But but the requirements, it doesn't say that you're required to then send it all to that. All it says is that you are required to, and so this is beginning on line 21 of page 21, separate the food residuals from other solid waste and ensure that the food residuals are diverted from final disposal in a refuse disposal system by, and then it lists options. So it could be reducing the amount of food residuals generated, donating serviceable food, managing the food residuals in an organics recycling system installed on site, providing for the collection and transportation of the food residuals for agricultural use, including for use as animal feed,
Oh, great. Sorry, I
et cetera, et
missed that.
cetera. So you have options. It's just, I think the reasoning for putting that limitation on the application of the bill is because if you are one of these sites, that's generating this quantity of food, potentially you are going to be looking for an organics recycling facility to handle at least some portion of that.
Okay, thank you. I missed that on that one page. Appreciate that. Thanks.
I think it's a lesson in bill drafting where they go from the general of people who are captured and then they slowly thin it out to the more detailed, which thins it out even further. So it's a life example. Senator Hester, did you have your light on before?
Thank you, Mr. Chair. So I was looking at the bottom of our voting packet 23, lines 26 through 33, where they talk about this study of state land that could potentially be used for an organics recycling facility, and that's been struck out. Is that an amendment we're adopting now, or was it struck out earlier?
Amendment, the Senator Hedelman's amendment is to conform to the House, and that's what the House did.
Okay, so there's two things about this amendment. One, I think it was a recommendation from, pretty robust report, and so I'd like to see this happen at some point. But I think that the reason it was cut out in the House was because of the cost. And so I don't know if, Mr. Chairman, if you talked with the B&T chair about the cost of this. I think it's only like $100,000. I don't want to slow the bill down. I was just curious if that had been a point of discussion.
No, it was at a broader level. It was not detailed over parts of the bill.
Okay.
I don't know what to tell you. Again, I don't know how much Senator Heddleman reviewed it and acknowledged that. We can also come back next year but it's up to the will of the committee.
If we can get approval from B&T, could I offer it as a floor amendment? Or we can come back next year. I don't want to cause us stress. Okay.
You know, I bothered them today. We had sent up the request about 2 weeks ago and hadn't heard anything.
Right.
So I talked to the chairman today. I think he's got a lot on his mind with the budget. So, I guess let's take what we got.
Yeah, okay.
And come back if there's no objection.
That's fine.
Okay. The amendment is to conform with the House version. Any objection to that? Okay, the bill as amended, it's House Bill 264, but we're talking about Senate Bill 483. Discussion on the legislation. Senator.
Yes, thank you, Mr. Chair. I'd just like to go on record saying that I am happy to vote in support of any bill that will help put health hazardous landfills out of business. Thank you.
I think this is a great start. I think we'll look back in a few years and hopefully this will become a growing movement that'll help all of us. So, okay. Will anybody be voting in opposition to the favorable bill as amended? Saying yes, you're voting against it? No.
Sponsor at some point.
Anybody else want to be added? Join Senator Hester, Vice Chair, and myself. Okay. No one will be voting no. That will be recorded as 11-0, and will hopefully go to the floor tonight or tomorrow or whenever. Ms. Morton. Let's go to 828.
Senate Bill 828, HIV prevention drugs, dispensing by pharmacists, and insurance requirements. This is sponsored by Senator Lamb. This bill authorizes a pharmacist to dispense HIV pre-exposure and post-exposure drugs that are aimed at HIV prevention if certain conditions are met. For HIV pre-exposure, a 30-day supply, but no more than the 60-day supply may be received if the following requirements are met. The patient is HIV negative, and this is based on a screening and consenting procedures. The patient also has to submit evidence of a negative HIV test or take an HIV test there. There's no refusal provision for the HIV test for pre-exposure, but an individual may refuse to take a test for post-exposure. In addition, a patient has to complete a self-screening assessment indicating that they have no HIV symptoms. The pharmacist must counsel the patient and provide notice to the patient on follow-up procedures at the time the drug is received. In addition, the pharmacist has to notify the patient's primary care provider about the dispensing of that drug. For post-exposure prophylaxis, a full course can be dispensed or distributed to the patient if the patient is screened to determine that exposure to HIV was within 72 hours and criteria is met as established through CDC guidelines. The patient also has to submit to an HIV test. However, if they do not submit to the test but meet other criteria established by CDC, they can still receive the drug. The pharmacist, in order to give a patient post-exposure prophylaxis, has to counsel the patient and provide notice to the patient's PCP, primary care physician. The bill also requires a pharmacist to complete training on dispensing pre- and post-exposure prophylaxis drugs that are approved by the Board of Pharmacy before they actually dispense these drugs. The board is also required, the Board of Pharmacy is required to consult with other boards in developing standards and regulations for the training program. There are a couple of insurance provisions. So under the bill, managed care organizations are prevented from placing prior authorization on pre-exposure prophylaxis or post-exposure prophylaxis. And insurance carriers in the private sector are prohibited from placing cost-sharing requirements in terms of co-payments, deductibles, et cetera, on ancillary services specifically. So HIV testing, pregnancy testing, anything that is not the direct dispensing of the drug, but it's ancillary and related to the drug. So opposition was presented at the hearing through managed care organizations and insurance carriers in the private sector, MedCai as well. Essentially, a couple of concerns that were addressed was the definition of pre- and post-exposure prophylaxis being a non-prescription drug could potentially conflict with FDA requirements. Additionally, MCOs, so managed care organizations, and MedCai, as well as Kaiser Permanente, were opposed to these prior authorizations because they can be costly on these managed care organizations and these private insurance carriers. There are two amendments that are proposed. One is by the sponsor. So the sponsor amendments alter the definition of pre- and post-exposure prophylaxis. That should be in your voting packet as well. Thank you. Alters the definition. So originally the definition of pre- and post-exposure prophylaxis is based on definitions provided by several boards within our health occupations statute and sector. It removes all of that and essentially confines and redefines pre- and post-exposure prophylaxis to those guidelines as expressed by and through the CDC. The amendments also state that the drug may only be given up to a 30-day supply, so clarifying that original dispensing requirement that said it could be up to a 30-day supply, but no more than a 60-day supply. So this isn't a material deviation, it's more of a clarification. The amendment also ensures that prior authorization and cost-sharing prohibitions do not apply to plans that were in place before the Affordable Care Act was created. And the prohibition on cost-sharing is expanded to include the distribution of the drug as a whole, instead of solely being focused on ancillary services. So as amended, managed care organizations and those managed care plans within the health market can't place any cost share requirements on the bill as a whole. So that's the Lamb amendment, sponsored by Senator Lamb. There is an amendment sponsored by Senator Penske, which was passed around separately and should be on the top there. And the intent of this amendment is to clarify some of the conflicting definitions on CDC, well, not on CDC, but on pre- and post-exposure prophylaxis. So in the event, or not in the event, with the sole goal of making sure that there isn't a conflict between our state's interpretation of pre- and post-exposure prophylaxis and the federal government's definition. So it's to make sure those are in alignment, and the way we define it conforms to the federal government.
This is a little controversial. Obviously, there is some opposition. We're going to spend some time on it. We'll see how we go, but we need to have something in front of the body. Is there a motion? It's been moved favorably. Is there a second? I'm going to be a second to get it in front of us. Senator Lamb, briefly, you want to talk about why? I know we had a hearing, but just refresh people's memory, please.
Yeah, so there's been development of new classes of medications that fall under what's called PrEP and PEP for individuals that have been exposed to HIV. So PrEP is pre-exposure prophylaxis, means that somebody who's taking this medication on a regular basis would be less likely to contract HIV if they were exposed to it. PEP, post-exposure prophylaxis, is if someone is exposed to, let's say they got a needle stick injury and they're concerned that the patient may have HIV, they'd be able to take PEP to be able to reduce the likelihood that they would actually contract AIDS. So the medications have a short time frame in which they need to be taken to be effective in reducing the risk of contracting HIV. And so this bill is to help increase access to those medications by making it easier for pharmacists to be able to dispense a limited number of these medications to these individuals that are seeking them, because it can be difficult or not timely to be able to get an appointment with a physician to be able to get a prescription to get this medication. And so these individuals will be able to go to the pharmacy and on a limited basis for 60 days get a supply so that they can get started on PEP or PrEP before they see a doctor. So that's the general gist of the bill.
Thank you, Mr. Chair. So is it normal that to not, for medications such as this, to not require a doctor prescription? Is that happened a good bit? Or I'm not familiar with these treatments, honestly, so is that an unusual thing?
So these are prescription drugs, obviously, and this body has from time to time decided that there are some drugs, because probably mostly because of access issues, that we feel comfortable with allowing pharmacists to dispense them, and for pharmacists to use their clinical judgment to dispense these medications on a limited basis until the patient then can see a physician or NP or physician's assistant and the like. And so, it really depends on the safety profile of this drug. These drugs are pretty safe, and that's why states have been moving towards this to increase access. This is obviously not for something that has a high risk profile and a lot of side effects.
That was going to be my next question.
Right.
What is the safety level of these? Because
Right.
I'm not familiar with them, honestly. Thank you.
I know the post. I'm not as familiar with the pre, but the time element is pretty important, correct?
Yes, the time element is important. That's why this becomes an access issue.
Thank you, Mr. Chairman. So, a couple questions. Is there any control, say, with age-wise children having access to this from pharmacists? This bill is authorized.
So I don't think the pharmacist would be dispensing it to children, and I think the Board of Pharmacy would be developing the regulations that go along with this. And so they would look at the safety profile, look at the medications, and it's probably best to be in regs because it's more nimble, and if the medications change or there are more medications that come out or the safety profile changes, it's easier to be dealt with in regs.
Yeah. Is that done with other medicines that pharmacists can?
Yeah, so like oral contraceptives, pharmacists can provide a limited dose for individuals that want to use that. So, in some instances, the state has moved to authorize pharmacists on a limited basis to dispense certain medications that we believe is safe enough and the benefits outweigh the risks.
Yeah, in your example, do they impose an age limit as far as for children with that example, do you know?
For this class of medication?
No, the example you just stated.
Oh, for oral contraceptives?
Yeah.
I think they do, but it's per the clinical guidelines for that medication. So when FDA approves of a medication, they say that it's only approved for a certain age and above. And so they would comply with that too.
So what kind of limits would, say, the pharmacists have? And someone, instead of coming in to buy, say, a set of condoms, they buy these medications. They want this medication. I mean, is there any kind of, is it all up to the pharmacist to ask these questions, or no one asks these questions? Or?
So the pharmacists would be asking those questions, and there would be regs that would be developed along. Sorry, there would be regs developed along those lines to be able to provide guidance to pharmacists as to how they can do that. But they would be using their clinical judgment to decide whether it's appropriate for that patient to receive it or not. But we obviously do allow pharmacists to use that judgment, whether it's maintenance injectable drugs or contraceptives or other things. It obviously is a little different than condoms. Condoms are over the counter; they're not by prescription. Yeah. So,
and one last final question, Mr. Chairman, may I? So on page 5 of the bill, section 2 says if the patient does not have a primary care provider or refuses to provide the name of a primary care provider, the patient with a list of physicians, clinics, or other health care providers to contact regarding ongoing care for pre-exposure prophylaxis. So I don't understand what that, I don't know if there's some words missing in there or.
So that's just a clause to say that, the motivation there is that we do want to have these individuals go to see a doctor, that this is almost like a starter dose in order to hold them over until they can get an appointment with the doctor, which can take some time. And if they don't have a primary care doctor, that they could be given a list of potential providers at a federally qualified health center or community health center to be able to go see to access that appointment.
Yeah, so I think this paragraph is missing a couple of words, like the patient will be provided a list of providers to contact.
Okay, I'll have a look and then.
If you could, yeah, thanks. Thank you, Mr. Chairman.
I think if it's read back on line 19, if a pharmacist orders an HIV test for a patient under subparagraph 1(2) of this paragraph, and skip the next one, and the patient tests positive for HIV infection, comma, the pharmacist shall refer the patient to a healthcare provider and provide a list. So I think in context with the sentence on 19 and 20, and I skipped 21 because it's an or, so you're like reading either one. So I think if it's read like that, and you pause after the comma on 24, it makes sense. But we can check it.
Yeah.
Vice Chair, I'm sorry, I
Thank
had
you.
Senator Washington Senator Washington followed by the Vice Chair.
Are you done? Oh, okay. Thank you, Chair. So generally speaking, I'm for expanding access, and all the supporters are people whose I respect, but that I can't ignore, of course, the other set of folks whose respect as we guidance who we respect as well. So the amendments, and I'm sorry I haven't been able to go back and forth to check, have the amendments addressed in particular the MMCOAs, which I do share some concern about having the prescription be a 60-day prescription. That does seem like a long time. Was there a contemplation, or give me some confidence why you didn't? Yeah, low. Yeah. I think 60 days is a long time.
So we're open to lowering that. I think part of it is trying to address that access issue that sometimes if they have a provider that it takes 3 weeks to get an appointment with because this is not an urgent matter. They're running right up against that line. And so, it gives them the flexibility, but, we don't want it to go over 60. But
Right, but could we just get, in other words, I guess I'm proposing, I don't usually do this. Yeah, so, I would at least want to strike up to 60, and that it just be a one-time, addressing the immediacy. And then I would suspect if the person should be able to get some doctor to fulfill the prescription.
I'm going to count that as
Yes, it's a motion a motion to strike the up to 60, and I guess with counsel, is it the 30 days or is it the one drug in the therapeutic class? I don't know which one best conveys that we just want sort of an initial treatment rather than sort of subsequent treatments.
Well, I mean, Ms. Foxworth, I'm looking on page 3 at line 17.
Yeah.
I think we'd have to get rid of that phrase, but not more than a 60-day supply.
Yeah.
It seems to me, is what we're talking about.
Yeah.
And anywhere else that shows up. Is there another place, Senator?
So it should be down below, sorry.
Yeah, that's where I saw it on page,
it's also in the middle of page 4.
yeah, on 8 and then on 4.
Okay, well, the bill committee council can make sure. Discussion on the amendment. Discussion limiting it from 60-day to 30-day. Senator Lamb, you want to speak to it?
That's fine.
Okay. Seeing no major objection, you want to speak to that, or that's on? Okay. Then it's the 30-day is adopted.
But
On the Lamb amendment. Madam Vice Chair.
I've got a couple of questions. So I did a bill years ago when I was in the House about the abortion bill, the morning after pill, and there was a real tick-tock emergency to being able to get the pill into the patient right away, or it would be a lot less effective. Senator Lamb was talking about the urgency of getting this like in a timely manner. Can you just talk about that? And then also the gap. I'm on page 5, lines 12 through 16. And it says, submit evidence of the patient's negative HIV test results obtained within the immediately preceding 7 days from an HIV antigen antibody test or antibody-only test from a rapid point-of-care fingerstick blood test that is approved by the FDA. So 7 days ago, patient X took a test and was HIV negative, but then had a hot night last night. And could be now contaminated, could now be vulnerable and have the virus. Can you just talk about the timing thing, the gap thing? Because in one instance, it was time and that was kind of it. In the other, I'm just confused. And then efficacy as a result of the timing. So what if these drugs were offered or given or something, and the person was HIV positive, whether or not that was manifested in a test? And then I also have another area of question.
Yeah, so the reason for that HIV test is to make sure that you're not facilitating antibiotic, well, this is not antibiotics, but not facilitating drug resistance, because these drugs are not antibiotics per se. But if someone already has HIV, there's not really a point to give them these medications because all it's going to do is try to breed resistance amongst the virus to this medication. So the reason for this test is that if it's positive, then you would discontinue the use of these medications for that individual.
But you wouldn't really want to start it if it's expensive and not going to work.
Right, but the reason to start it first is because, if you need to, you can start it because of the narrow window. But then if the test comes back as positive, then you wouldn't continue the usage of that as well.
That seems like not the right use of limited healthcare dollars is what I'm worried about. Okay, let me just ask one other thing.
Let's move
because
on.
I've gotten a bunch of testimony, and I was looking at all the opponents in the hearing and stuff. Is a skill or in terms of offering counseling and also assessing the test, the pharmacist has to refer to the healthcare provider because she or he doesn't have the expertise. I'm wondering about privacy and HIPAA in terms of a lot of pharmacists. The pharmacy is kind of out in the public, and hi, we're going to talk about your sexual activity, and let's just chat about that while Mrs. Jones is walking by with her cat food, and So can you just talk about all of that and what's appropriate for a pharmacist to be doing on something that really is quite private and maybe beyond their skill set? And then related to that, is there precedent? And I know that was like 10 questions.
I think for the test, they would just order the test for HIV. That if it's standard clinical protocol before you would provide these medications is to order a test. There's not that much clinical judgment that needs to go into just ordering a test. If you should order the test before you proceed further with the dispensing of the medication. So it's just kind of a binary decision there. The pharmacists do a lot of counseling already, and that's why more and more of these like retail pharmacy locations have been trying to have more enclosed space and privacy barriers and whatnot so that they can talk to patients in a private area. They have to ask screening questions for everything from, oral contraceptives that we just asked about, making sure that people are not pregnant. The same thing with flu shots. Have you had any, prior reactions to different vaccines, et cetera, et cetera? Those are all, protected health information that they would still have to ask. Everyone has different levels of or values as to what type of information is private, but it's all considered private, and so they have to have space to be able to ask these questions, regardless of the degree of privacy. They have to ask them in a private area. So, I think they would have that space to be able to do that. Otherwise, they shouldn't be dispensing whether things from flu shots to COVID vaccines to everything else.
So just a quick follow-up. Yes, I just think it's pretty different to say, did you have any negative reactions to a flu shot? And hopefully everybody gets flu shots too. Have you had anal sex in the last week? That's a pretty different question.
Okay.
Well, I don't know if they have to ask that question to dispense this medication.
And people obviously can vote against it if they think it's not ready for prime time. Senator, I have one quick question.
Sure.
The Department of Health said include language indicating that a pharmacist may prescribe and dispense HIV prevention drugs in order to comport with federal FDA prescription requirements, because that's different than CDC. Do you have a problem with that?
Can you repeat that one more time?
The board respectfully requests that the bill include language specifically indicating that a pharmacist may prescribe and dispense HIV prevention drugs in order to comport with federal FDA prescription requirements. FDA requirements are not mentioned in the bill. CDC is mentioned. And I don't know if they overlap or they're different, but it's, I guess, an additional standard of protection. Mm-hmm. I guess my question is...
Yeah, I mean, these drugs have to be FDA approved already, so...
Right, but the prescription requirements is beyond the drug being safe.
The prescription requirements, are beyond the drug being safe.
Right.
Right.
So do you object?
No.
We putting a sentence in?
That's fine.
Okay. Okay, yes.
So a couple of thoughts and clarification points. So the amendment, Senator Lamb, if we abide by what the board is asking for, would essentially limit the distribution so that it wouldn't violate FDA standards and requirements. I'm not sure if I made that clear the first time, or if that was clear enough in what I described.
So they would limit,
It could potentially limit it, right? So it wouldn't just be we're distributing these or dispensing these in accordance with, well, it would be we're distributing these in accordance with FDA requirements, but it may limit it if the FDA is saying we can't dispense them without a prescription. So that could be kind of a supplemental consequence of it comporting with what the FDA is saying. So a clause being in there to essentially say, we're going to authorize pharmacists to prescribe them so they can be dispensed without violating the FDA requirements is a little different than saying what I originally said. We're prescribing them in accordance with is different from we're describing them so they don't conflict with, essentially. And the overlap between CDC and FDA guidelines, I'm not keen to or with, but.
so what you're saying is that if we add that language in there, it binds us to FDA's restrictions, and
Essentially.
that could cause an issue with us being able to dispense
Without a prescription.
non-compliant with FDA's prescription requirement.
Right.
Okay.
Okay. I don't know the answer to that question. I think it's going to mean a phone call with Department of Health. Senator, is there a cross file?
I don't think so.
Let me ask this. I'll get to you in a second, Senator. There are a few questions here. I mean, I'm ready to support it if we can take care of these amendments personally. I don't want to spend a lot of time. I don't know where the body is on this. I'm going to ask an informal straw vote just to get a sense of how much time we want to spend on this today or even next week. I mean, we can do it and send it across and it goes to rules, but we get the ball rolling on this issue. I know the Center of Doctors in Public Health and believes in this and the access question that Senator Washington talked about. How many are inclined to vote in favor of this bill with the amendments, and if we can clean up this last issue of the FDA? People can vote against it, okay? I don't want to drag it and sort of spend time and mush it around. I want to get a sense of the body. How many are inclined at this point, and I'm not counting your vote, this is not an official vote, how many are inclined to support this bill with the amendments? I see 3 hands. Oh, I'm not sure. I see 2 hands. Is yours up or not? Instead of watching, I'm not taking a vote. Okay.
But I would not be prepared to vote yes at this time, even with the amendments.
That's fine. I'm not taking a full vote.
Got it.
I see 4 hands that at this point are inclined, under right conditions, could vote for it. I mean, if there's 6 that say it doesn't matter what we talk about, I'm going to vote against it, we can dispense with it. How many are inclined to vote against it? Okay, so it's 4, 2, and 5 aren't sure where they are. Okay.
Can I request that we just hold it for now while I?
No, absolutely. I'm not going to vote. One, your assignment, Senator, or Ms. Foxworth, is to check with how we would deal with the issue raised by the Department of Health regarding whether, if we adopt the FDA language, we could still authorize its use without a prescription. I think that was one of the questions I heard. And we'll come back and take it up. You know, sometimes the bill takes more than a year, and if we move it, that's a step, even if it doesn't pass this year, or if it's dead, it'll be dead. So that's a hold. Okay. I'm going to, we have 2 more bills. We're going to start and try 889, at least to put it in front of us.
Senate Bill 889, Controlled Hazardous Substance Facility Permit, Research Facilities, Chemical Warfare Material Requirements. This bill exempts the incineration of chemical warfare materials at a research facility from state-controlled hazardous substance statutory and related regulatory standards that are specific to the incineration of chemical warfare materials if the incineration is done for research, development, or demonstration purposes. A research facility is defined as a facility designated by the U.S. Department of Defense for the research, development, and demonstration of technologies related to chemical warfare materials. In your packet on page 33, you will see some suggested amendment language from the Maryland Department of the Environment. In general, they did not oppose the intent of the bill, but they did want to clarify that chemical warfare materials incinerated at a research facility in accordance with the bill are still subject to regulation as controlled hazardous substances. So I think the intent was really just to exempt them from a specific subsection in that particular provision, and so the MD wanted amendments to clarify that.
I'm sorry, Senator?
Move the amendment.
Please.
Thank you. I have to share with you, I really appreciated Dr. Lamb's, Senator Lamb's questioning and his probing. We had a work session with Ms. Morton, Dr. Lamb, myself, fellow from Bryson Popham, and the fellow from Aberdeen Proving Grounds, and I think one other person, April, wasn't it? Somebody else who was knowledgeable. Anyway, the presentation we had at the committee was lacking. Love Senator Jennings, but he did a pretty high-level review of what's going on. Even our experts, so to speak, from the Aberdeen Proving Grounds was so technical, he was difficult to follow. So in our little work group, it took almost a half hour for him to finally say, and I don't think this came out earlier, that MDE issues permits. The permit process is deliberate, extensive, and overseen by the EPA. Since our meeting, Ms. Morton was kind enough to send out an email. We got a response with an attachment that has a page and a half of the process by which the MDE goes through to determine whether or not a permit should be issued. And we also had a significant discussion upon how the experiments are conducted in an enclosed building with no direct outside ventilation, but rather a series of ventilations that take place to screen out the hazardous materials. And the other interesting thing that came out, Mr. Chairman, was this research facility at Aberdeen is similar in a sense to Fort Detrick, where they do a lot of biological type of research that we all know, anthrax, sarin, and all kinds of other crazy stuff up there. The testimony in our work group is that over the past 25 years, we haven't had one death, we haven't had one major exposure. These are professionals who know what they're doing, and after the work group, I feel very comfortable in recommending that the committee move forward with these and include these amendments. Thank you, Mr. Chair.
Okay. I mean, I appreciated the time that it took for us to meet with them and to understand it. I think what struck me from that meeting was that they could not describe what type of chemicals they intended to incinerate there. They didn't have any specific chemicals in mind, but nor could they tell us what chemicals potentially in the future could be incinerated there. And then I was also struck by the fact that they had said that it could be up to hundreds of pounds of these types of chemical, I guess, weapons that would be incinerated there. That while on one hand it's framed as this is for research and development, I think I went in there thinking this was going to be small amounts in like a test tube in a fume hood. the description that they gave said that it could be all the way up to hundreds of pounds of these types of material. So it gave me a lot of pause in thinking about it. I think that was helpful. I agree, the session was helpful to understand what they actually had in mind. But it seemed like it was very broad to be able to just lift this prohibition right now, to give them kind of carte blanche to do what they want to do without any additional limitations or understanding of what those chemicals are, what they could be in the future, and the actual quantity, because it seemed like it was much larger than I was expecting.
You all right? Thank you, Mr. Chair. Could any one of the task force members who was on this committee give me any indication as to whether or not there has been any concerns on the part of the community? What type of oversight evaluation would exist to make sure that everybody in full compliance, EPA, DER, whatever?
Thank you, and I'd be very happy, April, after the meeting, why don't you go ahead and send that attachment around to the committee, and I'll read from the attachment that the Maryland Department of the Environment sent out. They talk about subject to the same public participation requirements as regular CHS, and I'm not quite sure what, controlled hazardous material? Permits. Publication of a notice upon the receipt of a permit application. It's not carte blanche. They have to apply for a permit for a very specific process. That's number one. So there's a publication and an opportunity to request a scheduled public information meeting. Once the MDE has completed its review of the application, publication of a notice of tentative determination on an application that includes either draft permit or notification of the intent, similar to a stormwater, water. We have a lot of water permits that are floated around, and landfill permits that this is what we're proposing, open the door for a testimony. And then it also specifies the limitations of the study, whether the waste and their quantities proposed for use in the study are appropriate. And I think the testimony, Senator Lamb, was some of this stuff we acquire from our enemies, and we don't know what they have on the battlefield. We don't know what they have in their arsenals, so that this is a general acknowledgement that we're going to move forward, but it's still subject to all the other stuff. In regard to the review, to conduct research related to the incineration of chemical warfare materials, particular attention would be paid to the following: nature of the waste, nature of the process intermediaries or waste created in conducting the study, the equipment's capability to prevent dangerous release, that's the building, the ventilation, operational controls for the process equipment. Will there be gauges and monitors to see if there's any release? The facility has a monitoring program. There's secondary emissions, operations training, plans for decontamination and decommissioning. I mean, this is a very extensive process. And the other interesting thing, Mr. Chair, is some of this stuff is top secret.
Yeah.
It's national security. And even if they had something they wanted to talk to us about, it was said several times they can't.
But as we know, trust me is a double-edged sword. I'm not saying they're right or wrong. I think I had Senator Ellis first.
Thank you, Mr. Chairman. And so I was going to echo what Senator Riley just mentioned, dealing with the DOD and going through some of the stuff here, the testimony, a lot of it submitted by the same person, the Smith, Sarah Jones Smith. And then when I click on some of the testimony that was submitted, this one organization called JRAD, and then I click on another testimony submitted, and from a Maryland Defense Research Coalition, at the bottom of their letterhead, JRAD is on this too. So it just seemed like, tight circle, if, this continues the mission of Aberdeen, which is essential for national security and dealing with some of these chemical weapons, and they've done it in the past successfully. As long as they're monitored by Maryland Department of Environment and they work closer together, I'm okay with not knowing all their stuff, but trusting that national security, they're there, serve that essential function, and, just kind of go with their desire to continue to perform their national security functions.
Thank you. So I feel as though for me, in reading the opposition, again, we banned these dangerous chemicals for a reason. And it seems like to just say we're going to have all these, I guess I would like to see all the protocols in place. I mean, we just passed a bill raising the requirement, saying that if you wanted to get a permit, you need to reach out to the community. We've just done some things to engage communities more in keeping, crematoriums or landfills or any number of things out of communities and giving them an opportunity to be a part of this. And this is, we're giving carte blanche, we're removing a ban and giving carte blanche to not, and I'm with Senator Lamb. I thought it was like, little experiments here and there, but that's not what they're saying. They're destroying tons and tons of what is known to be dangerous chemicals. It's also interesting that they want us to, as a part of this legislation, remove the warning that these are dangerous and hazardous chemicals. So, I thought Senator Ellis was going someplace else. To me, the fact that it's this small little group just seems to be a warning sign that this really is, an attempt to continue a mission regardless of the potential public impact. And so I'm very not at all supportive of this bill.
I have a question maybe for council or colleagues who have better knowledge in this. I've had a few quick conversations. So I heard everything that Senator Washington said, and I'm reading testimony, and I was just reading the Chesapeake PSR, the Physicians for Social Responsibility, and certainly their testimony is strong. I understand that the congressional delegation is deeply worried about this and supportive of this, and I also understand that this is a terrible phrase, but economic development, like it's important that it comes here, comes to Maryland in terms of jobs, prestige, visibility. Might be I'm overstating that. And then the third thing is like we're already doing this, and this is no change. This is basically codifying current practice. No. Okay. So that's where if you could help me with those are three questions that I have, please.
To clarify, there is research on chemical weapons being done specifically at Aberdeen right now. There is research, moreover, on the destruction of chemical weapons that's happening right now. Right now, that research does not include incineration, in part because it sounds like it hasn't been a method that they've necessarily needed or wanted to research up until now, but they do, based off of the conversations that I have had with the people involved in this research facility, they think that could at some point be a possibility where they want to look into that sort of technology. Right now, what is happening at Aberdeen is that they are doing research on other means of destroying chemical weapons, either through neutralization. They talked specifically about some sort of technology that uses magnetic waves somehow to destroy this substance. The issue is that right now, or their concern is that right now in the law, there is language that deals specifically with the kind of prohibiting the incineration of chemical warfare weapons unless it meets these kind of very specific requirements that they would not be able to meet in a sort of research context. So that's where they say it's already happening. It's already happening that they're doing research on weapons and they're doing research on destruction. They are not currently incinerating anything.
Let me just briefly, before I call on Senator Hester. I think many of the questions today that were asked about the HIV and the pharmacists, that were asked about this bill, in normal years, they probably would have come out at the hearing. I think we are not, because of the one dimension, we're moving quickly during the hearings, and we're not always getting to the deep questions, which historically I think we're more likely to ask when there's a witness there and they make a statement. And we would follow up with saying, well, can you do this, Mr. Pharmacist or Ms. Pharmacist? Or is there any danger to incinerating this? And I don't think, it's no one's fault. I just don't think we've been holding our probing questions for when we take it up in front of us. And I think when we're not doing things virtually, and other people have been around other years, we've probably had more of those probing questions happening during the hearings than there was a real live person there. So I say that that this bill's 889 and Monday has crossover. It's my understanding they're not using the incineration. They can't use it yet. And part of me thinks, you know, if we had a bill that came in early and had a hearing and had time to push some of these questions, we might feel more comfortable and more knowledgeable. That being said, I mean, I'm not going to stop it from having a vote, but there's some of my concerns. Now, I also want to say it's 12 of 6, so I'm going to have Senator Hester, Senator Gallion, Senator Hester, and then we'll finish with Senator Lamb, and we're going to make a decision. We actually have one other bill, which I don't know if we're going to get to. Senator Gallion.
Thank you, Mr. Chair. So this actually is in my neighborhood, so to speak. I live in the same zip code as part of Aberdeen Proving Grounds, too. You have the Aberdeen and the Edgewood parts. And I can tell you, I would just like to speak to how they are as a neighbor in the community. Number one, APG is the number one employer for Harford County. So that's one thing to keep in mind. Also, I've had a chance to take my firefighter training through where it was the Northeast Regional Training Center was on base, where you had to go through the security and all to get to it. They've since moved it to a place where you don't have to go through that. But they've always been a great community partner. So honestly, I don't have concerns about them doing things the wrong way or negatively affecting the local community, because I've seen, you know, pretty much for my whole life living in that community, just how good a neighbor they've been. So I really don't have that concern, and I've had that that front row seat to kind of how they do business, honestly, there. So, you know, I strongly, support this. I feel very comfortable with it. You know, I live, you know, real close there, you know, with my family. Right now, the main thing you hear coming from there when they're doing some testing, you can hear those loud type explosions. And if you're in that neighborhood, you kind of get used to it. Oh, they're testing at APG today, you know. But it's, and honestly, our Senate office hasn't gotten any kind of complaints or that I've been in office the last 3 years. So I feel really comfortable with it and would like to see it moved favorable. Thank you.
So the question that I also heard the same thing, that our congressional delegation was in favor of this. And the question that I asked was, you know, have they seen the actual legislation to make sure that the appropriate safeguards are in place? And I'm hoping to get that answer, but I don't have it yet. So I think this probably is a priority bill, but we need to make sure the legislation is drafted correctly.
So what are the implications of that statement?
I was told that we would get confirmation from somebody in Washington, D.C. that they had reviewed the actual language of the legislation.
Did they say when they'd get back to you?
I think it was 24 hours, and I asked around 3 o'clock.
As we know, we have three choices. We can vote it up, we can vote it down, we can hold it. So I just, you know, I don't know, like I said, I don't know the implications, but think on my question, and Senator Lamb, almost the final word. I'm sorry, Senator Washington had the final word.
A few things. I guess, one, I have not seen a letter from, our federal delegation in the committee testimony, so I don't know, if the federal delegation support is really there. I think what Ms. Morton said was true, that they are doing chemical neutralization. Now, chemical neutralization is adding chemicals to the chemical weapons so that you turn it into some inert type substance, and I think that's a much different calculus and safety profile than incinerating the weapons back up into the atmosphere, into the environment. And up to this point, Aberdeen has not had to do incineration. A, they're prohibited from doing incineration, and B, even with all of the mustard gas that they had there for many, many decades, they were eliminating that by chemical neutralization, not by incineration. And so all of the recent means of eliminating these types of chemical weapons have been done through neutralization. I think the permit process is very different. I mean, this is, even with the public input and all of the outreach into the community, this is not just a landfill, and this is not just a crematorium or a stormwater permit. These are chemical weapons that are being burned and released into the environment. They're byproducts released into the environment too. And we just don't know what is in this in terms of, what potentially could be those byproducts that are released. I'm not sold by the argument that it has to be done here, that, this could be, I think, done somewhere else where it's not sandwiched between I-95 and the Chesapeake Bay. It's a very sensitive environmental area, obviously. And, I'm just not sold on the argument that it has to be done here. And then with the language that's in the bill, it also says, research and development, I kind of generally get what R&E is, but it also says for demonstration purposes. I don't know what demonstration purposes means and what that's defined as. Demonstration could be a lot of different things. And, if it's up to someone just to decide that I want to demo this, could they just go ahead and do that? I think that's also a poorly defined term, and I don't know if there's a statutory definition of that, but I think it gives me some pause too.
Thank you. Everything that Senator Lamb said, and again, just note, I mentioned it, but again, on page 2, they're removing, since these chemical warfare materials are highly toxic and carcinogenic, that's being taken out. And while, and I appreciate also that, we've spent a lot of time, so it's that something like this, when you incinerate something, it doesn't just impact the immediate community. So I do respect Senator Gallion, but it does go up into the atmosphere and will move down 95 and potentially, to me and my family. It's very broad. There's not a lot of detail. If there was a lot more detail, and I think we deserve to ask for it. I don't think we have to wait for a congressional delegation to read the legislation. We can read it. There was not a lot of thought on this. It's just like we want to do it. We want to do it for a range of reasons that aren't really specific. We want to call and say that it's affecting jobs, but it's not affecting jobs because they've never done this work before. And so I think we deserve, as this committee and the people of Maryland, if you're going to suggest that we incinerate toxic, carcinogenic, warfare materials, that the bill's got to be a lot more detailed than what they've deigned to give us thus far. So thank you.
We're going to go to appear to vote. Roll call. No, you can pass. The motion is the bill, the 889 as amended. I just assumed they were adopted. I apologize. It's late and there's no cross-file, if you were asking. Senator Hester, you have a quick question?
I was just going to say that if it's a priority bill for the congressional delegation, then we should get the language right. I mean, can't we still take some time, get the language right, and send it over to the other house and tell them that they've got to move it out of rules? Because
Look, one way to do that, Senator,
Yeah.
is it needs 6 affirmative votes to pass. If you pass or vote no or abstain, it won't get 6 votes.
But I don't want to kill it, though. I just want
No,
time to
if it
improve the
doesn't get
language.
6 votes, it's in limbo. Well, no, I want to get clear on this. There are at least 2 people who are not ready to vote, but they don't necessarily want to kill it. Now, I don't know if there are 6 votes or not for the affirmatives. Let me ask this. If it doesn't get 6 affirmative votes, it's an unfavorable. Can we not report the unfavorable and reconsider it? We can do whatever we want if you have the votes.
If you have the file in the office.
Okay. Look, I want to be fair to all parties here. I mean, I'm going to vote no. And I respect the people who want something clearer before them.
Can I clarify one thing on the demonstration language? So the research, development, and demonstration, that has to do with federal controlled hazardous substance laws. That is a.
I'm not sure that's going to change.
Okay, but it is a permit, a specific permit that you have to get for research, development, and demonstration. So just to clarify.
Hey, look. Again, I don't know how some people on this side are going to vote. We're going to do this. If people aren't ready, they should either vote no or pass. If it doesn't get 6 votes, I will sit on it. Okay.
Are we going to do that on all bills?
No, but
You can always reconsider, right?
yeah, but it takes more votes and more people could kill it that way. Look, I want to be fair here. I think the point is, if there are not 6 votes, we should hold it because it could have 6 votes tomorrow or Monday. And I think if it's that important, it'll get out of rules. I think is what I'm hearing, and I'm trying to be fair to everybody here. So, is there any objection to doing a straw vote so we know if it's got 6 votes? Okay, those that will be, right now will be voting in favor of the bill. Raise your hand. I see 4 hands.
That's why I'm not, I need to.
Look, no, I'm doing this to either avoid a vote and killing the bill. That's what I'm doing. You can't be heffies now. I mean, we can go ahead with a vote, but if it doesn't get 6, it's dead. So I saw 4 votes. I'm going to make it a hold. We're going to get more information. If it's that important, it'll get through rules. Senator Ellis.
Going through this bill and processing this information, I would love to vote for it, support our federal mission. But going through this bill, going through the testimony, I see nothing from the DOD. I see nothing from Aberdeen. I see nothing from the federal partners who support this. And so I'd love to vote for it, but I would love something from those organizations. Right now, I don't see that. Everyone's saying Aberdeen, but Aberdeen is not in the bill. I don't see that name in there.
There's no judgment on any vote. There's an unreadiness.
Yeah.
It is still before us. We will get more information,
Right,
and at the end, people can still vote yes,
Yeah.
no, or abstain.
So I'm just saying, Mr. Chairman, that for me to vote for it, I want to vote for it. I need to see something from
Senator,
the folks.
no explanation.
So-
It's on me
Yeah.
that it was held.
Okay,
There's no judgment to anybody for voting for it or against it.
sure. Thank you.